Yes, actually, initially, when the COVID-19 virus has started infecting the human population, it was found that this virus is only affecting the lungs and causes very serious complications related to lung. But as the epidemic goes on and converted to pandemic, the cases of involvement of heart will also increase. So the study has been done and it has been evaluated that this virus also affects the heart. Now the question is how. So this virus affects the heart in basically two ways. One, it increases the thrombogenicity of the blood. That means it increases the blood clotting tendencies. Now, blood clotting causes one of the most important issues with the heart is coronary artery disease, what we commonly known as in layman language as heart attack. This virus causes destabilization of plaques inside our heart vessels and leads to complete occlusion of these vessels, and that lead to acute myocardial infarctions that mimics the heart attack, and patient will land up in the emergency in catastrophe. The very second important thing that is found with this virus that it causes swelling in the heart muscles. Now this is very important as many of the virus causes all this, but this virus also has a strong affinity for our heart muscles, and because the numbers of patients who are getting infected with this virus is very high, so the number of patients who are getting their heart involved with this virus is also high in number. So in muscles, what it causes inflammation of the vessels. Now, when the inflammation or swelling of the heart muscles occurs, it causes heart functioning improper. Now, the main function of the heart is to pump the blood via contraction. Now, when this inflammation occurs, the pumping ability of the heart get reduced. And as you very well know, we don't have any good evidence regarding how to treat the cardiac effect or effect on the heart for these virus. So better we should understand and we should keep safe by following the guidelines. Okay, now this is very important questions. Now I address these questions for both the patients who are suffering from heart disease as well as the patients who are not suffering from heart disease and healthy individuals. So very first important thing that I want to say for the patients who are basically suffering from heart disease that you should maintain a good healthy lifestyle. This is very important. So what is a good healthy lifestyle? So first important thing is that you should maintain your routine in this lockdown period. What How should you maintain your routine? You should get up at your proper time. You should do some of the exercise that can be very well performed on floor inside the house, because avoid I ask this our patients to avoid going outside because you don't know when you get exposed to somebody. Keep yourself busy. This is very important because right now as there is no work for anybody, so most of the time we are busy in basically we are busy in doing in watching TV and most of the time sitting. So for this, I want to remind you more than 6 hours or at least 6 hours of sitting is equal to smoking. So all of my patients who are either suffering from cardiac disease or not having cardiac disease, please do not sit for longer duration. I was talking about eating healthy diet. So in this period, my suggestion is for a 3 meal diet. And 3 meal diet is basically a breakfast, good breakfast, a moderate lunch, and a very light dinner. In between, snacking is allowed. And the very important thing, avoid sugary snacks. So third important thing in diet I want to suggest is fruit. You should increase your fruit intake, at least one fruit per day during this period. Last, I want to tell you regarding your mental health. You should maintain your mental health as well. Stay connected with the people. Try to avoid smoking inside the house. Try to avoid taking alcohol. And last thing, This is only for the patients who are of heart disease. Please skip to your don't skip your medication. This is the time where you can very well adhere to your medication. You can have a you can say strong will to take your medication at time. And we do not want to listen from you because I don't have time. That's why I'm skipping the medication. So this is very important question because in this period of lockdown, there are lots of patients who are in lots of individuals I probably say who are in some sort of depression, who are in some sort of stress. My suggestion is that we have to follow certain things. First important thing is stay connected. Stay connected with whom? Stay connected with your family members, your mother, father, your wife, your friends, either via phone, either via chats, and you stay connected with your kids because this is the most important way to de-stress your life. If you have kids at your home, you stay connected with them, you enjoy with them, you play with them, and this is applicable to all patients also and general individuals also. The second important thing for de-stressing is a meditation. Meditation, I always find a very good way of de-stressing your life. You always get up early in the morning, get fresh, and do meditation at least for 15 minutes. Maximum you can go for 1 hour. You can have many slots in the day. But yes, meditation do wonders in my patients. And sometimes I have found that many of the patients who have controlled their blood pressure along with the medication and meditation. They are two wonderful things. Third is reciting positive thoughts. Now, this is very important because in this time of negativity, we have to maintain a positivity. Anyhow, whether we think, whether we don't think, we have to maintain a positivity because human race has to maintain a positivity to run away for all the epidemics, pandemics, and any catastrophe that is occurring in the world. So always maintain positive affirmation with yourself that yes, everything will be going to fine. Every financial status will be going to be okay. Second, be grateful to the God. This is something all human beings should do. They should remain grateful to the God for whatever they have given, for whatever He has chosen us to do in this to do for in this world. Be creative. This is also very important. Go back to your childhood. You look because I'm a doctor. I'm a very busy person. So many times I don't have opportunity to follow my passion, what I have in my childhood. So now this is time where I get some of the time for myself. So all my advice to all of you is that take out the time for your childhood when whatever is your passion, whatever you like in your childhood, you like singing, you like making arts, you like crafts, go and do yourself with your kids. This is a very enjoyable activity and you might de-stress yourself. The last thing I want to convey is disconnect yourself with all negative news because in this era of social and media, which is extensive availability, I can say, because it is available to you since you open your eyes until the night. So because of extensive availability, there is lots of negative thoughts that comes in your mind, lots of negative news that comes in front of you. Try to avoid all these things. Only focus for a fewer duration to all of the news that is genuine and you should know rest of the thing you see whatever is enjoyable, whatever is entertaining, you just focus on that. And last thing is a very good sleep. Try to avoid sleeping in the day so that you get up at late night. In my opinion, whenever a drug is prescribed to you in a given format and a given dosing, you should always take this because we are usually prescribing these drugs after having lot more trial, lot more studies. And when we found that the benefit of taking these drugs are very high as compared to not taking these drugs, then only we prescribe these drugs. The first important thing is that don't think a lot, just take it. Second, I just want to emphasize a very important study that was done in Finland. And this study has taken 73,000 patients. Look at the huge number of the patients, 73,000 patients. And they don't do anything. They just prescribe them medication for their hypertension. And they studied the patients in two groups. One who is taking their medication regularly at proper times. Second, those patients who are not taking or adherent to their medicines, taking it regularly, not taking, living for some time, thinking they are now well, not taking. And when they observe after 10 years down the line, they found that patients who were not taking their medicines regularly, the risk of stroke, means a brain attack and a heart attack, increases by 7 times. Now, 7 times means very high number. That means objectively we define that if you don't take your medicine, you will going to suffer. You are not going to suffer the next day. It will make you suffer 10 year of your life, sometimes 5 year of life. And this is most important problem because the hypertension is a silent killer. Practically, we do not know whether it is going, when it is going to affect. So better to don't skip your medication because when you are suffering from hypertension, you are suffering from a silent disease. Your doctor can assess that thing, but maybe a time, many a times you are not able to judge the result on the short term because we are the doctors, we know the studies, we look after the long term results. So my advice is always you take your medicine at proper time, take your medicine at proper doses, get an electronic blood pressure monitoring machine. Take your blood pressure routinely once in a week is quite good for any hypertensive patient. Always know your number. Know your number means always know what is your blood pressure so that whenever your doctor next time asks you what is your number, so you can very well say yes doctor, my number is 140 by 80. So this is a good healthy strategy to keep yourself healthy and to be on proper drugs and maintain yourself. As you all know, we have started celebrating the World Heart Day from 2005. So the question is why we started all these things, because hypertension is a silent killer. So many of the time we do not know, we see only the complications of hypertension. So what happened, we decided to celebrate this day in order to make our public educated enough to know what is hypertension. The theme for this 2020 World Hypertension Day that we are going to celebrate on 17th May is that you should know your hypertension, you should know your numbers, you should control it, your blood pressure, and you should maintain a healthy lifestyle to prevent the long term complications. So, my advice to my patients on this World Hypertension Day is that you should, as we have in 2019, I already told everybody you should know your number. In 2020, I am just telling everybody you should know your number as well as you should know how to control it. You should know when to go to the doctor. You should know what healthy lifestyle you should achieve for, for stopping hypertension. I want to tell you only two things. Stick to medication, stick to exercise, and stick to fresh, green leafy vegetables and fruits. This is the theme and this is the basics of hypertension management.